Hi, this is one of the very important video because many people undergo annual health checkups voluntarily and some people through other offices. So they check their basic blood parameters once in a year. It's very important to understand some important blood reports. Why? Because you see the people how we are. If you're interested in shopping, you know many details about the cloth, brands, all those things. If you're interested in cars, if you're passionate about cars, people will knowing so many details about the cars, including the engine specification, build, country, brand, so and so. But it's in the similar way, it is important to know some details about our own health, and the blood test determines our health. So in this way, this knowing this blood test is not like it's only a job of a doctors. As a common man, you must understand the basics about these blood parameters so that when you see your blood test, you should know where I am heading. Many times what happens, people come with a bundle of blood tests to my clinic or in a hospital. In 10, 12 minutes, 15 minutes consultation, it's very difficult to explain each and everything in detail. We just point out what is abnormal and we'll say lifestyle modification or give medication for that. But to keep explaining each and everything will take a long time. So this video I'm making particularly to know the important blood test and their brief importance in a common language. The number one, the triglycerides. So triglyceride comes as a part of a lipid profile, a cholesterol test. So whenever in your blood report test, if you see that triglyceride is above 150, that indirectly understanding that you are eating too much of refined carbohydrates, you're eating too much of sugars, and you're not exercising well, and this also indicates alcohol intake. So in these conditions, the triglyceride usually goes above 150. And there are some other parameters like even thyroid, people with hypothyroid also have high triglyceride. That's a different thing. As a related to metabolism, if you are eating too much of carbs, sugars, beer, or not exercising properly, triglyceride usually go high. So if the triglyceride is less than 150, it's good. And if it is less than 80, still better. This is one of the important blood tests. Then comes second, HDL. This also a part of a lipid profile. We call it as good cholesterol or high density cholesterol, lipoprotein. So why this HDL is called good cholesterol? Because it removes the cholesterol from the blood vessels to the liver, so that it will prevent the formation of a plaques. And this HDL is also having antioxidant and anti-inflammatory properties. If your HDL is not in the normal limit, ideally HDL should be between 50 to 90. If the HDL is less than that, that means either you are not exercising properly or your metabolic health is not good. So keep your HDL between 50 to 90. And third important is fasting sugar, fasting blood sugar. So usually what we do, fasting blood sugar will be checked at least minimum 8 hours after the last meal. Like for example, what happens, some people visit a hospital or a clinic at 11 o'clock, 12 o'clock, but they come in a fasting state. If you ask, I am in a fasting, you can do any blood test now. See, fasting doesn't mean that you have to fast 13, 14 hours. Suppose if you had a dinner at 9 o'clock, if you visit a doctor clinic at 11 o'clock, 12 o'clock, that is more than 12 hours. So no need of that. The minimum duration is 8 hours. The range is keep it 8 to 12 hours maximum. If it 8 to 10 hours is still better. So to give accuracy of the fasting blood sugar, at least 8 hours after the previous meal time. Here, when you do fasting blood sugar, suppose if it is more than 125, so it clearly indicates that someone is having a diabetes. Suppose if it written 100 to 110 to 124, we can say arbitrarily he is having a pre-diabetic. Not only this important, we also see HbA1c and other parameters. Suppose if fasting blood sugar is more than 100 and less than 110, even though it cannot be called as a pre-diabetic, it indicates you are having insulin resistance. Insulin resistance test is an early sign of diabetes. Matlab, somebody is having insulin resistance for 10 years, later they develop pre-diabetic or diabetic. So we can call it as, if the fasting blood sugar is above 100, you may be at the verge of developing a insulin resistance. So if the fasting blood sugar is less than 100, that's good. Fourth comes HOMA-IR test. Many people are not aware of this test. This HOMA-IR test give a clue that in future you may develop a metabolic syndrome, diabetes, or any diseases linked to insulin resistance. This HOMA-IR test, usually it's calculated by medical formula using a fasting insulin and a fasting blood sugars. So I'm not mentioned separately. They use fasting, they measure fasting blood sugar and also fasting insulin. They calculate a formula and they will measure a report called as HOMA-IR test report. Ideally, HOMA-IR should be less than 2.5. For example, someone is having fasting sugar only 80, which is absolutely normal. And somebody is having fasting insulin 25-30, that is very high. Then your HOMA-IR comes around 3 or 4. In this way, if your fasting blood sugar is normal, that doesn't mean that everything is okay. Even though your fasting blood sugar is normal, your fasting insulin is high, then your HOMA-IR test comes high. That indicates your future risk of developing a diabetes and other metabolic problems. Even with the children with obesity, as per research, if they have high HOMA-IR, that indicates that in a few years, maybe in another 10 to 12 years, they may develop diabetes. So this is one of the very important metabolic test. Unfortunately, many health packages doesn't include that, and many people doesn't give importance to this. But as like a fasting blood sugar, this is also a very important metabolic test. Next is HsCRP. Say C-reactive protein. It's actually protein. HsCRP is a protein. Why it's important? See, HsCRP goes high because of any inflammation or infection. Suppose somebody having any infection, sometimes even the COVID times, we are checking this HsCRP very frequently because people used to have high CRP, matlab they have a bad pneumonia or a bad inflammation. Without any infection or any other inflammation, if the HsCRP is high, that indicates that your body has a chronic inflammation. This chronic inflammation coupled with insulin resistance is the primary cause of all these metabolic problems like a diabetic, hypertension, cardiovascular diseases and strokes and even PCOD. So it is HsCRP, if anything more than 2, it is not good. HsCRP, if it is less than 1, that is more or less optimum. This is also one of the important tests you should look out in your annual blood checkup reports. Sixth comes HbA1c. This many diabetic people are aware. In spite of that, being a diabetic, many people doesn't check HbA1c frequently. HbA1c matlab a glycosylated hemoglobin. That means this will give your average blood sugar control over a period of previous 3 to 4 months. So the best is to keep it less than 5.8. If it is between 5.8 to 6.4, we call it as pre-diabetic. If it is more than 6.5, we call it as diabetic. So if you are not having diabetes, just keep it less than 5.8. That's always good. But this test also has some limitations. Suppose if you have hemoglobin low or high, if you have a chronic kidney diseases or any hemoglobin abnormalities, then this test may not give you accurate results. In this way, there are sometimes it can be spuriously little low or little high, depending on the other parameters. So you should be knowing that your doctor will assess depending on the other parameters. So seventh important is uric acid. This uric acid is, most people think that if you eat a non-veg, uric acid go high, and if the uric acid go high, it will cause joint problems like a gout or any knee pain like that. I will explain briefly about it. See, uric acid is a byproduct of fructose metabolism, and it increases by eating a purine rich animal foods like a red meat and some seafoods and alcohol, especially a beer. Uric acid is also a byproduct of fructose. Where we get fructose? Fructose is there in the any processed foods like a sodas. All these cool drinks people drink, it contains fructose. Even that can cause uric acid. If you're continuously drinking cool drinks or soft drinks or sodas, that will spike your uric acid, not only non-veg. And any high fructose corn syrups, sauces, all this contains a fructose, and that after breaking down lead to uric acid. So don't think that only eating non-veg will lead to uric acid. If you are limiting your fructose and carbohydrates, if you are eating optimum non-veg, then your uric acid will become normal. And if you are eating too much of purine rich foods like a red meat and seafoods, then uric acid may go high. As well as if you take regular alcohol, especially more with a beer, uric acid go high. So uric acid is, if it high, one thing is it may cause the joint problem called gout. More than that, it is a metabolic parameters. If the uric acid is, remember this, if the uric acid is above 6, there are different values for a men and women, but arbitrarily fix it one point. If it is above 6, that means there is a metabolic problem. So try to keep uric acid, whether men or women, both less than 6. So uric acid is not only related to your joint problems and non-veg, it is more of a metabolic parameter. And comes this enzymes, ALT, AST and GGT. These are liver enzymes. When you do any health checkups, these are a part of a liver function test. And suppose this AST, ALT, if these tests are high, suppose if the reports are high, it indicates a metabolic dysfunction and also a possibility of a fatty liver. And suppose GGT is another very important test. Sometimes many liver function tests doesn't include this GGT. This indicates body's oxidative stress. So whenever the body is in oxidative stress, there is a generation of lot of free radicals that can disturb our metabolism and that can also lead to some cancers. So if the GGT is very high, that indicates the metabolic stress and your overall health is not good and body is in a chronic inflammatory state. So the recommendations, there are very standard range for this. So it is better to keep your GGT less than 25. And on an average, keep this AST, ALT less than 20. There are a lot of confusions are there. There are various reference ranges, but I'm just summarizing for understanding. Keep your GGT less than 25, AST, ALT less than 20 for a good metabolic health. And the ninth and very, very important thing is vitamin D. Actually, vitamin D is not a vitamin, it is a hormone which is synthesized in our body when we expose our skin to sunlight. As simple as this. Among all the vitamins in our body, the vitamin D is very important. It is linked with the secretion of cytokines. It is linked to secretion of insulin, which is indirectly related to diabetes. It is linked to a pathophysiology of many cancers. Like this, it has numerous functions. If your vitamin D low, if it is less than 20, that we can call there is a pro-threat to your health. That means your overall health is not going well, your nutrition is not good, and your lifestyle is not good. So vitamin D, the standard range is keep between 20 to 40, and it is optimally better if the vitamin D is between 40 to 60. So don't worry about the vitamin D toxicity, but unnecessarily don't take vitamin D without a prescription or without checking. Vitamin D should be taken with a prescription depending on the values. And there is various formulations available like injections, soft gel capsules, liquid suspensions and tablets. If it is vitamin D is less than 10, better to go for injections. If it is more than 10, a liquid suspension or a soft gel capsule is also a better option. So I'll make a separate video in future about vitamin D. The last comes vitamin B12. So vitamin B12 is a catalyst which converts our food into energy. So you heard of people keep telling that I'm having low energy, even after eating I am getting tired, my nerves are burning, I have some paresthesia, dysesthesia. If any of these symptoms are there, most likely they might be having vitamin B12 deficiency. So vitamin B12, if you keep it above 500, it is good for energy. So see, between 200 to 900 is a range. And there is a different range for active vitamin B12. The normal range is 200 to 900. If it is less than 200, definitely deficiency is there. So you have to take both injections as well as tablets. But if it is above 500, it is optimum. That means you have it gives you good energy. The problem many people having vitamin D deficiencies, vitamin B12 is absorbed in the only small part of the intestine called ileum. So in the whole gut, lengthy gut, duodenum, jejunum, ileum. In the whole jejunum, only in the small part of the ileum, the vitamin B12 absorption takes place. Suppose because of your some chronic inflammation, some other disorders, your ileum is also inflamed, then vitamin B12 may not get absorbed and you tend to have vitamin B12 deficiency. So because of the absorption issue, many times if somebody is having a vitamin B12 deficiency, usually better to take injections along with the tablets. Because we take injection, intramuscular or IV, it directly goes to the blood and you will get a rapid increase in the vitamin B12. So these are the 10 very important blood parameters you must look into in your annual health checkup. And nowadays we are seeing even people as young as 15, 16 and 20 having many abnormalities in this kind of blood test. And I have seen even adolescents, 14, 15-year people having a very severe deficiency of vitamin D. So it's very important to know something about all this blood test. And apart from this, there are other important blood tests which are not mentioned here, like thyroid hormones, your RBC magnesium, your kidney function test, homocysteine, and others. There are, if you take a big list, and also sometimes micronutrient levels. So here I explained the very basic blood parameters one must know and which is easy to remember. That's it.